Privacy and Security Brainiacs is pleased to provide you with our first quarter of 2021 HIPAA enforcement summary. Since April 2003 through March 31st of 2021, there has been a total of 99 HIPAA civil money penalty cases, and there has been a total of $135,298,482 of HIPAA penalties applied. 6 HIPAA noncompliance fines and penalties were applied in the first quarter of 2021. 5 penalties were for HIPAA noncompliance discovered following complaints from individuals for the HIPAA right of access requirement. These additional 5 penalties brings the total penalties applied for violating the right of access HIPAA requirement to 18 as of the March 26th penalty. There was another penalty applied for a protected health information or PHI breach from one entity that involved HIPAA noncompliance violations. All 6 of the penalized entities were covered entities. In addition to the monetary penalties, each penalized entity was required to implement comprehensive corrective action plans, or CAPs for short, and up to 2 years of monitoring by the Department of Health and Human Services Office of Civil Rights, or HHS OCR for short. The total of all 6 of the fines for the first quarter 2021 HIPAA penalties is $5,540,000. Now, I will provide summaries about each of the 6 entities against whom penalties were applied by the HHS OCR. Banner Health is a covered entity located in Phoenix, Arizona. Banner Health was given a penalty amount of $200,000. What was their HIPAA violation? Well, it was not responding to 2 different patients' requests to obtain access to their associated medical records. Patient 1 requested her medical records in December 2017 and did not receive the records until May 2018. Patient 2 requested his medical records on July 15, 2019, and then again on September 6, 2019, and did not receive the records until February 11th of 2020. In each case, the records were not provided until after each of the patients had submitted complaints to the HHS OCR, which then contacted Banner Health for each. This was the 14th penalty the HHS has applied for violating the right of access requirements under the HIPAA privacy rule. Lifetime healthcare companies, collectively called the Excellus Health Plan, is a covered entity with locations in upstate and western New York. They were given a penalty of $5,100,000. Factors considered for determining the penalty and settlement activities included non-compliance with multiple HIPAA security rule and privacy rule requirements. In addition to the monetary settlement, Excellus Health Plan must also undertake a corrective action plan, or CAP, that includes 2 years of monitoring and oversight by the HHS OCR. Here's an overview of the breach. On September 9, 2015, Excellus Health Plan filed a breach report stating that cyber attackers had gained unauthorized access to its information technology systems. Excellus Health Plan reported that the breach had actually begun on or before December 23rd of 2013 and ended on May 11th, 2015. Hackers had installed malware and had conducted reconnaissance activities that ultimately resulted in the unauthorized disclosure of PHI, which included names, addresses, dates of birth, email addresses, social security numbers, bank account information, health plan claims, and clinical treatment information. A total of 9,358,891 individuals had their data breached. Renown Health PC, a private not-for-profit health system, is a covered entity with locations in Nevada. They were given a $75,000 penalty. Their HIPAA violation? Not responding to a patient's request to obtain access to the patient's own associated medical records. The patient originally requested access to the medical records in January of 2019, but did not receive access to those requested records until December 27th of 2019, almost a full year later. This is significantly longer than the HIPAA requirement to provide access as soon as possible, and more specifically, a covered entity must act on a request for access no later than 30 days after receipt of the request. This was the 15th penalty the HHS OCR has applied for violating the right of access requirements under the HIPAA privacy rule. Sharp Reese Steely Medical Centers, or SRMC for short, is a covered entity located in San Diego, California. They were given a $70,000 penalty. What was their HIPAA violation? Not responding to a patient's requests to obtain access to his medical records. The patient requested access to the medical records on April 2nd, 2019, but was not given access to them. So, the patient reported the HIPAA violation to the HHS OCR. On June 25th, 2019, the HHS OCR closed the case by providing technical assistance to SRMC to help them to comply with the request. However, they did not do this. On August 19 of 2019, the patient filed a second complaint against SRMC with the same allegations that SRMC still had not responded to the request for medical records. SRMC ultimately did not provide the patient access to the requested records until October 15 of 2019. This was the 16th penalty the HHS OCR has applied for violating the right of access requirements under the HIPAA privacy rule. Arbor Hospital is a covered entity located in Jamaica Plain, Massachusetts. They were given a $65,000 penalty. What was their HIPAA violation? Not responding to a patient's request to obtain access to his medical records. The patient requested access to the medical records on May 7, 2019. When no action had been taken after 30 days of waiting, the patient reported Arbor Hospital to the HHS OCR. On July 22, 2019, OCR provided Arbor with technical assistance to help them understand their obligations regarding an individual's right of access to PHI, and then they closed the complaint with the understanding that Arbor Hospital was going to provide the medical records to the requesting patient. They did not provide those medical records to the patient, though. So, on July 28, 2019, OCR received a second complaint from the patient against Arbor Hospital, alleging that Arbor still had not responded to his request. As a result of the subsequent OCR investigation, Arbor finally produced all of the requested records on November 1st of 2019. This was the 17th penalty the HHS OCR has applied for violating the right of access requirements under the HIPAA privacy rule. Village Plastic Surgery is a covered entity located in Ridgewood, New Jersey. They were given a $30,000 penalty. In consideration of additional factors, they also had several more requirements beyond a monetary penalty. Village Plastic Surgery agreed to comply with a corrective action plan, again, which is often called a CAP for short, and it included reviewing and revising policies and procedures for how to provide individual access to PHI, updating and distributing those policies and procedures to all workforce members, providing privacy training specific to these individual access to PHI policies and procedures to the workforce members, sending documentation to the HHS OCR to show proof of the previously listed actions, promising to investigate every report of the workforce member not complying with these policies and procedures, and retaining documentation about these activities for at least 6 years. What was their HIPAA violation? Well, you can probably determine this by their CAP that I just described. Their violation was not responding to a patient's requests to obtain access to his medical records. The patient requested access to medical records in August of 2019. Village Plastic Surgery failed to provide the patient with timely access to a copy of requested medical records and had still not provided access as of the date of this agreement when it was published in March of 2021. This was the 18th penalty the HHS OCR has applied for violating the right of access requirements under the HIPAA privacy rule. We hope you found this summary of the first quarter 2021 HIPAA penalties and sanctions useful. For more in-depth training, Privacy and Security Brainiacs asks you to consider our premium HIPAA training modules and other information security, privacy, and compliance training modules. In addition to each paying client receiving a free business admin account with a learner management portal and a variety of reports and capabilities to manage all of their workers and learners, each training module has an associated quiz and a certificate for each person taking the training and a special certificate for each person who scores above a specific high percentage. Also, the larger the number of learner seats purchased at one time for a class, the lower the price for each learner seat. And there are no subscription fees, so no recurring charges for those months when no one at your organization participated in training. Please see our website, www.privacysecuritybrainiacs.com, or get in touch with us using the email address info@privacysecuritybrainiacs.com for more information. Also, please check out our site often for a growing number of free and premium training modules covering a wide range of topics. Thank you.